Can we talk about our good friend, the placenta? The placenta attaches to your uterus and it helps filter the blood between you and the baby as the baby grows and lives. Can you believe that this thing keeps baby alive for 9 months while it's in your womb? It is an amazing thing. I would encourage you to look at it. Did you know that the placenta has 3 blood vessels that come off of it? 2 of them send nutrients to the baby and oxygen, and 1 of them, the baby sends its toxins back to you so that you can pee and poop it out for your baby. So the placentas are good friends. Check it out. Amounts of stress during pregnancy are actually really good for your baby, but large amounts of stress that you aren't coping well with are not so good for the baby. This week's podcast is all about that. Pulling Curls podcast, Pregnancy and Parenting Untangled. You can find it through the link in my profile. You get nothing, which is not true. So if you tear and you don't have an epidural, of course, we will numb you up. It's like a little sting and a little bit of burning, and then it is numb and you don't feel the stitches. So that's awesome. Like this one. So yeah, clearly this woman's had the baby. She's had her C-section. She's still alive. You got to remember that a lot of what the nurse is doing is like a preventative measure. So they're trying to do things to prevent you from dying. That's why we do fundal massage. So if we didn't do it and you're still alive, it's going to look after delivery. It's not going to be nice and round like this one. It's going to be a real cone shape. And the bones in the head move so that your baby can get out of your pelvis a little bit easier. Obviously, very important because sleep. In fact, a lot of people end up waking up and the contractions are just getting harder and they've slept through the beginning of labor. So don't be afraid of sleeping during labor. It can help your body relax and get you some rest. And during pregnancy, it shifts. This part loosens up, which kind of makes these bones change. And as it kind of goes a little bit wonky, it really stretches the tendons and ligaments that go down towards your feet. So I actually had plantar fasciitis bad during pregnancy as a working nurse and all those different things. So if you're having feet or leg problems, talk with your doctor about what kind of stretches you could do. And if they're kind of clueless, I would ask for a physical therapy consult so that you can do stretches at home to really make things easier. You're going to have a nurse and baby will have their own nurse. That nurse is trained to know just kind of what doesn't look normal. Your pediatrician will be required to visit the baby within the first 24 hours or whoever. Sometimes your uterus doesn't want to get in the game. It doesn't want to contract, even though your water's broken and you should start into labor. Most people will start into labor once their water breaks, but sometimes it doesn't happen. There are really 2 choices at that point. You can either wait. Or you can start some Pitocin and get things going. Now, you don't have to go to the hospital right after your water breaks, but the problem with water breaking is that then your uterus is kind of open to the outside world. And so there's a chance for infection because you obviously have bacteria in your vagina. And the baby's not used to bacteria. It's used to being in the sterile uterus. So that's just something we watch out for. We'll take your temperature very frequently. We'll monitor the baby. Talk with your doctor once your water breaks to see if you need to go right in or if you can hang out at home. Talk with your provider what to do when your water breaks or if you think your water's broken because it can even be confusing. So it's not unusual.
So
uterus, come on, get in the game.
All different kinds of emotions during pregnancy. Happy, sad, floods of emotion. Very normal. However, I would talk with your provider because they might have a few quick questions where they could make sure that what you're feeling is kind of in the bounds of normal because it's hard to diagnose that on TikTok, but very normal to have different floods of emotion as long as you're still having very positive emotions at the same time. There is such a thing as pregnancy depression. So if you've had floods of emotion, tell us in the comments so that people can interact and find out stuff about that. This is a judgment-free zone, so if somebody did or did not have floods of emotions.
Did you know that bladder infections can feel an awful lot like labor? I had a bladder infection with my first. I had no idea, but I was so miserable. So if you have a lot of just feels bad in your abdomen, call your doctor.
Maybe great question I wanted to answer right away. So the bag is surrounded by your uterus. The placenta kind of is part of the bag and plugs into your uterus so that it can get blood supply from you into the baby. So that's how it works. The placenta surrounds the baby, but the amniotic fluid surrounds the baby with the amniotic sac, and the placenta is part of that and plugs into your uterus, into your blood supply, so the baby can get nutrients.
Have you ever wondered what the heck the amniotic sac even is? Well, it is a bag that goes around your baby, and then the uterus is around the bag as well. Now, if it breaks at the top, you're going to get little trickles of fluid, and if it breaks at the bottom, you're going to get a big gush. So the amniotic sac is full of fluid, and most of it is, in fact, baby pee. So that's what the amniotic sac is. We offered 3 medications after birth. There is erythromycin ointment, there is a vitamin K shot, and there is a hepatitis B shot. So I would talk with your provider to find out what works for you and what you want the baby to have.
Really in my area, but I've definitely used them, and I have to say that sometimes the smaller one isn't any more helpful because you need a larger one, just kind of depending on the size and what's going on down there. So just because it's small doesn't mean it's going to get the job done. What you mostly want is that when your legs get super numb, sometimes you just aren't able to push effectively. Most people get into the groove of it after 5 to 10 pushes, but sometimes people just aren't feeling anything and they find it really hard to push and they aren't very effective while they're pushing. So we have a few options. We can turn off the epidural. So the epidural runs through a pump where we can change, we can speed it up, we can slow it down, all those kind of different things. So we can turn it off. Not my favorite because I still want you to not feel if they have to do stitches. We can cut it in half, which is a favorite of mine. The other thing is a lot of times people are pushing that button because they're afraid. Stop pushing the button. Also, sometimes just giving it a little bit of time, your body kind of works those kinks, especially as baby gets a little bit lower. So my favorite is cutting it in half. Usually your nurse will suggest it, and then she has to get the okay from anesthesia sometimes. So yeah, and sometimes the doctor just orders it.
Your pelvis. And a lot of people think just because you have big hips or you're big boned or you're overweight, it makes it easier for the baby to come out. But really, it depends on how your pelvis is tilted inside your body that makes it so the baby can come out. So it's really hard to tell.
Feelings about being put to sleep during a C-section. So let me give you a few of the things that aren't so great about general anesthesia. Your pain control is not near as good. You're going to need a lot of narcotics to try and be close to comfortable after surgery. Your supportive partner cannot be in the room when we put you under general anesthesia. It's just too much for you to have an extra person in the room. We don't invite people into surgery normally anyway. So with general anesthesia, most hospitals I've worked at, they can't be in the room. And also you won't be able to see your baby right after they're born. You won't feel as involved. It'll just feel like something that just happened to you instead of something you were participating in. So we really also, one other thing, baby gets some of that general anesthesia. So we try not to have baby get too much. We do the surgery very quickly after we put you under, but baby can get some and it can make them a little bit more tired. All those studies go either way, but I prefer my baby having less of that. But general anesthesia, it's not our favorite. Sometimes we have to use it if it's a real emergency, but a lot of times we can give you a spinal or an epidural that can make you a lot more comfortable. Wouldn't bounce on it because your round ligaments are going to hate that. What you're going to want to do is some sexy hip circles with your hips so that you can try and help the baby find a position in your pelvis that they really like. So yoga ball is your friend towards the third trimester. If you're not getting good enough sleep, pillows can really help you. Put one under your belly to help support it. Put one between your knees to help support your hips. Put one behind your back so that you're not sleeping flat on your back. Pillows can really help you. Nurse is going to come in the room after you have the baby, and she's going to push where your baby used to be on your uterus to make sure that it's clamping back down so that scab where the placenta used to be doesn't bleed out. It's really important. It's a great way to keep you safe, even though it can be uncomfortable. The con for eating during labor is that you might throw up. And so if you do, you've made the choice. You throw up. A lot of times I tell people that if they want to eat, they're going to have to hold their own barf bag. You can make the choice. And if you throw up, then you've made the choice, right?